isn't that the cutest picture? I've longed for a day like this as I laid in bed just under 2 years ago. Preeclampsia, preterm labor, blood clotting disorders, gestational diabetes, Hyperemesis gravidarum, and wait, that last one, have you heard of it? Hyperemesis gravidarum is a pregnancy disease that affects 1 to 2 women out of each 100 pregnancies. It is far less well known than the other pregnancy complications, but just as severe if it's left untreated. While morning sickness affects at least 80% of pregnant women, hyperemesis is a condition far more severe. It is severe nausea and vomiting so bad that a woman cannot accomplish her normal tasks, such as preparing meals, showering, and taking care of her other children. Women with this severe nausea and vomiting are often left unable to get out of bed, or even move side to side in bed without vomiting. We lay very still in hopes of surviving longer than 30 minutes to an hour without vomiting. We puke when it is morning, noon, and night. Not 3 times, but 12 and 14 times. Some women up to 30 times. The more you eat and drink, the more you vomit. A far cry from morning sickness. Complications of hyperemesis, or HG as we refer to it, are dehydration, malnutrition, confusion, severe weakness, passing out. In severe and untreated cases, it can lead to miscarrying, liver and kidney failure for the mother. Charlotte Bronte, author of popular book Jane Eyre, is believed to have died from this, and she quotes, "Let me speak the plain truth. My sufferings are very great, my nights indescribable. Sickness was scarce a reprieve. I strain until what I vomit is mixed with blood." End quote. HG has no known cause or cure. The reoccurrence rate is expected to be about 80% or more in future pregnancies. All of us who have suffered desperately want a cure. Thankfully, there is treatment for us. Usually the course of action first taken is anti-nausea and vomiting meds used for cancer patients. The most common one is Zofran. Some others used are Phenergan, Compazine, and Reglan. When these do not work orally, suppositories and then midlines and PICC lines, semi-permanent ports, are put in for meds to be taken in through. These carry the risk of infection and blood clots and are to be used when the benefits outweigh the risks, with proper home health care professionals to change the medical dressings. When these options do not work, feeding tubes or TPN may be administered through a PICC line, bringing nutrition into the mother's body. Hospitalization is often needed for fluids several times during each pregnancy. Doctors and nurses once thought that women with this problem were doing it to themselves, that they had eating disorders or they were trying to have a miscarriage. This highly offensive thought process has been debunked. It has been debunked as doctors and nurses have seen hyperemesis more and know more how to treat it, but there are many doctors who still do not understand or believe women, assured they are overreacting because it is only 1 or 2 women in 100. One woman I've helped was told she would not receive medical help at the hospital until she vomited up food to prove she was actually sick. These experiences are unfortunately not uncommon. Women will not get better until medical professionals take a stance to proactively treat hyperemesis. I cannot possibly write about the physical side of hyperemesis without mentioning the emotional side. The physical trauma of vomiting for so long, and sometimes the lack of support the family has, financial burdens. It is very common for women to experience anxiety, depression, and even post-traumatic stress disorder. The Hyperemesis Education and Research Foundation speaks of post-traumatic stress disorder, saying, quote, "One problem healthcare professionals have in determining if a hyperemic woman has post-traumatic stress disorder is figuring out what exactly is the cause of the trauma. Because the hyperemesis experience involves so many upsetting events, it is much more difficult to single out one event as a cause of stress than it is for other traumas, such as natural disorders or rape. For hyperemesis women, the stressful incidents may be related to frequent episodes of vomiting, many relapses with a worsening of symptoms, painful and stressful procedures, fear of death or loss of unborn child, complications such as severe infection or convulsions, scary scenes such as vomiting blood, treatment delays or insufficient treatment, and not being taken seriously. Some women may also experience abandonment and abuse, causing further trauma." End quote. The needs of women with HG are great. It is overwhelming the amount of help one feels they need when they have hyperemesis. Here is where you come in. May 15th, 2004 is Hyperemesis Awareness Day. Share this video on social media. Look for videos on YouTube of hyperemesis and share those also. With Princess Kate having HG, there's been much more media on it. Find some links and share them. If you know of a woman with severe morning sickness, tell them of hyperemesis and of the Hyperemesis Foundation, www.helpher.com. Women with HG also need someone to help watch their kids and keep their house running while they are ill, and someone to take them to the hospital. Women with HG are highly sensitive to smells and will often vomit at the scent that is good or bad. Try not to wear perfume or strong deodorant around them. Clean with less potent cleaners in their home. It would be wise to not suggest any food to the woman as it may make her more sick. Just ask frequently if you can get her any fluid or food and pick them up for her. Oftentimes, quicker treatment and more proactive treatment is the best way to ensure that the woman will not get too ill. With my first pregnancy, I was sick well through the whole pregnancy, although lessening by about 20 weeks. But with my third, although it was the most severe, I was starting to feel better at only 13 weeks because of the proactive care. I also lost less weight. One additional way that you can help with hyperemesis is by sharing information around your community. I'll have a link below for flyers and brochures that you can print out. For more information on Hyperemesis Gravidarum, please visit www.helpher.org.